Monday morning after another wonderful weekend. Summer sure feels good. Hopefully you're getting out and enjoying it. With us this morning, we have Dr. Michael Rousse from NVRH, and he's joined us today to talk about, we've been hearing a lot in the news, monkeypox. And Dr. Rousse, first off, good morning.
Good morning, Jeff.
Great to have you here. You and I seem to chat quite a bit throughout the year.
Well, diseases keep happening, and we always have a lot to try to tell the public about what to look for and how to avoid things.
Okay, well, we've been hearing an awful lot about monkeypox in the news, and I mean, a lot of folks are still reeling, still dealing with COVID and such. I'm just going to start things right off here with a very direct question. Is this, or could this be, I know it's a little early to tell, but is this as serious as what we've just been through with COVID-19?
Yeah, Jeff, it's really not. Monkeypox is more of a skin disease. It's a virus that infects the skin and causes pox-like lesions on the skin. Can make you feel a little bit sick. You can have low-grade fever, chills, exhaustion, that kind of thing. But really, there have been no deaths from monkeypox in the United States. It is not a lethal disease. It's certainly worrisome because the pox are themselves somewhat unsightly, and for about 2 to 4 weeks you can feel a little bit sick, but it's not lethal.
Okay, well, I want to ask you this here. Everybody knows chickenpox. Seems like every kid in the world has it, and every parent's had to deal with it. And the symptoms that you just described sound very, very similar to that of chickenpox. Yeah,
there are similarities. It is a completely different category of virus. It's in the category of smallpox, and many of your viewers who are a bit older, say 50 plus, may remember getting vaccinated for smallpox. And in fact, if you got vaccinated for smallpox with that scar-like lesion that's probably on your arm, that probably provides some protection against monkeypox.
Okay, no, that makes an awful lot of sense then. So then the next question, and I'm sure that there are hundreds, if not thousands, of our listeners out there that want to know, because they've been talking in the news about vaccinations and stuff possibly being developed for it. How important is this?
Well, there's been a vaccine that is used both for smallpox and monkeypox for quite some time now, but it hadn't been used much, and there isn't much of a stockpile of it. So that's been the concern. There isn't enough vaccine to vaccinate everybody, but indeed there's not really a need right now to do mass vaccination for monkeypox. Everybody does not need to get vaccinated for monkeypox because the illness itself is in a fairly limited subsegment of the population. Primarily, right now, men who have sex with men or people have contact with men who have sex with men, and it has to be direct contact with their skin or their clothing or bedding. So you really have to come close to somebody who has monkeypox. It's not spread by airborne droplet. You could be in the room with somebody who has monkeypox, and as long as you don't have direct contact, you're safe.
Well, when we're talking about a small segment, it seems to me that the last numbers I heard, and this is globally, and I want our listeners to understand this, globally, there's a few thousand folks that have it, and I think the last population count, we're getting ready to hit 8 billion. So would you term this as a very serious or very large number?
So the numbers are pretty small, 32,000 in the world so far, and about 10,700 in the United States. As of the other day, there have only been 2 cases in the whole state of Vermont. So the numbers are very small. The reason that there's these warnings from the World Health Organization is it has the potential to spread. If it were to suddenly if everybody had it, then it'd be tough to avoid it. So you do want to try to control the spread. The primary treatment right now is case definition, case identification, and then testing to figure out who has it, and then trying to isolate until those lesions crust over so that it doesn't turn into a pandemic-type illness. It is not a pandemic right now.
That's what I was waiting to hear right there. Listeners, with us, Dr. Michael Rousse from Northeastern Vermont Regional Hospital. So as we wrap this up, Dr. Rousse, what is your advice to our listeners out there that may have some concerns about monkeypox?
Well, it's really having an awareness of your risk. So who you come in contact with, and that would be primarily somebody who has a new characteristic rash and someone who may have some high-risk behaviors, which would be primarily contact with men who have sex with men. So if you don't see any of those risk factors, you're probably pretty safe. Right now in Vermont, there have been 2 cases, so we're really at a very limited outbreak here in Vermont.
Well, that's good to hear. So folks then don't need to huddle away and hide and wear masks and all that stuff. Is that our takeaway?
Right, you do not. And there will be no stay-at-home order because of monkeypox. Schools will be able to be held, and we really are not in the same position as we were back in March of 2020 when COVID was on the rise.
Well, Dr. Rousse, thanks for putting our listeners at ease here. Is there information available, or will there be information available at the NVRH website?
Yes, the NVRH website and the Vermont Department of Health website both have excellent information about monkeypox, pretty much all that you would need to know.
Thank you so much, Dr. Rousse, for taking your time with us. From NVRH, Dr. Rousse with us every other Monday. We chat with our community members. Doctor, we hope you stay safe. And again, we can't thank you and your entire crew that have kept us safe through everything that's gone on, not just in the last couple of years.
Thank you, Jeff.
All right, enjoy your morning.
Thanks.